All right, everyone. For this video, I'm going to go over something that is a little bit different from what I normally do on this channel. I normally use this channel to sort of, what is the word? Let loose on the stuff that I go through on a weekly basis. For those of you who don't know, I've been applying to medical school, and I was recently accepted to 2 very good medical schools in the United States. And I'm also a public health student at George Washington University in Washington, D.C. And on top of that, I'm a healthcare worker at Think Whole Person Healthcare in Omaha, Nebraska. Hi, everyone. I'm going to now begin to go over this COVID-19 vaccine forms that my company's given to me. I don't want to give away where I work because I think that would just be a bit of a breach of privacy on my part. But I do say that I work in a clinic setting in Omaha, Nebraska, and I'm very grateful that my clinic has given patient-facing staff like me who are not physicians. Well, not yet. I will be a physician. But I'm very grateful that they have given us access to these vaccines because I think that as a person who sees patients regularly, including we had 2 people on our schedule today with coronavirus, but luckily both of them canceled. One of them actually unfortunately had to be readmitted to the hospital, and the other one decided to see us with a telehealth visit. My point in saying that is I regularly see people with COVID, and I decided that the second I would get the opportunity to get the vaccine, that I would. And now I'm going to go over why I think it's a good thing to do, but I'm also going to go through some of the unknowns. And I'm also going to include scanned copies of the forms that they have given me at the very end of this video so you can understand what I'm going through when I'm talking about this paperwork. So they've given me a form called the Douglas County Health Department COVID-19 Vaccine Mrna Consent Form. Based on that, you can probably tell that I'm getting the Mrna COVID vaccine. The Moderna one is the one that was developed by these researchers out of Cambridge, Mass. They're pretty affiliated with Harvard. And they use mRNA vaccine technology. mRNA is a molecule in your cells that stands for messenger RNA. Basically, RNA is a molecule that is transcribed from DNA and is used to build cellular proteins outside of the nucleus. So the DNA codes for specific strands of RNA that are then taken outside of the cell's nucleus to build whatever proteins the cell needs. This COVID vaccine is giving us mRNA sequences for the body to produce the spike protein that is produced by the SARS-CoV-2 virus. And the goal of giving us a vaccine that does this is if the body sees this spike protein as a foreign invader, it will produce antibodies that will fight this virus because they're fighting the spike protein. And in fighting the spike protein, the second that your body actually gets infected with SARS-CoV-2, then your body will recognize it and it will combat it immediately and prevent it from taking hold of your body and prevent life-threatening consequences like potential death. So I'm going to go through these questions one by one, and even though you guys may not know where I'm getting this form, I will upload all the forms that I'm going to go over here at the very end of this video. So stay tuned and keep watching the video to see the end, to see the paperwork that I have at the end. First question is, have you ever received a COVID-19 vaccination? My answer is no. And the reason that they're asking this is because they don't know if there's some sort of cross-reaction between Pfizer and Moderna. They don't want you to have had the Pfizer vaccine. They also don't want you to have had the Moderna vaccine early and have a reaction to it, maybe because the antibodies are too strong and you'll get a reaction. So the reason is they don't want you to have any sort of reaction that could be tied to having a prior dose either earlier than you're supposed to or have a sort of cross reaction between the 2 vaccine companies and their different vaccine products. Have you received any vaccines in the past 14 days? No, I have not. The last vaccine that I received was, I believe, the yellow fever vaccine in 2017. Do you feel sick today or have a fever? I feel great today. I had a very long day at work. I had about 12 hours at work. So I do not feel sick and I do not have a fever. I just have a little bit of seasonal allergies though, but that's it. Have you ever had a severe reaction to any vaccine? I have not. There are people that may, and they would have to explain it in a little hyphenated line below. Have I ever had an anaphylactic reaction? The answer to this is yes. When I was 3 years old, my grandmother gave me an Indian sweet, and it's called a kaju barfi in Hindi, which is like a cashew flour cake thing. I can't explain it to you in American English terms, but I had a reaction to it. I had a full-blown anaphylactic shock, which basically means that my body's immune system basically fought back and unnecessarily, and I had to go to the ER when I was 3 years old. So they want you to put it down so that they have it on their records and that they can keep an extra eye on me after getting the vaccine. So I believe on Wednesday when I get the vaccine that they are going to make me be observed by them for about 15 minutes. 15 extra minutes from the regular people who've not had anaphylactic shock. So, do I carry an Epipen? The answer is yes. I carry it occasionally. Excuse me. I carry it occasionally when I go to India to restaurants because I don't know where they put cashew, and it's always a good thing to have. However, I've not been to the doctor in about a year. I have to get my yearly physical done, and I haven't because of COVID. And I have not gotten the EpiPen refilled. So when I go for my next physical in about 3 to 4 months, I will have to get that refilled. Am I pregnant or breastfeeding? No, I'm not. I'm neither pregnant nor breastfeeding. Have I ever had a reaction to latex? The answer is no. Do you have a blood clotting disorder and or take anticoagulant medication which may result in increased bruising? Now they're asking me for 2 reasons. They're covering 2 bases here. First thing is they want to make sure that you don't have some sort of genetic coagulatory disorder like hemophilia or a mutation to factor 5. In doing so, they protect against their own liability because if you bruise, then it's like, oh, they got the vaccine and were advised that they could bruise given their history. Second thing is, a lot of elderly people and people who have cardiac arrhythmias, which are heartbeats that beat irregularly, a lot of those people tend to not have properly functioning coagulation because they take blood thinners. And the blood thinners, what they do is they prevent the blood from clotting, which will prevent heart attacks and strokes, but it will also increase your risk of bleeding because your clotting system, which is what the body uses to repair wounds, it is disrupted. So the reason they're asking that is because they want to cover their bases, and they also want to make sure that you are aware of your own medical history and that you are aware that you are taking these medications. Now, the last question on this piece of paper is, in the last 90 days, have you ever received passive antibody therapy as part of COVID-19 treatment? The reason they're asking this is because this is sort of similar to the first question that they asked, which is, have you ever received a vaccination? And it's just, they don't know what the association is between getting the coronavirus vaccine and having a reaction to it. Getting antibodies and having a reaction to the antibodies when getting the vaccine. There we go. That's it. They don't know what that entails. So the FDA believes that the minimal reaction time to getting the vaccine after having gotten the monoclonal antibodies that are used to treat COVID is about 90 days. So they want you to have about 90 days before they let you get the vaccine. And this is because in people who've had COVID recently and get the vaccine, they have seen a little bit of a slight uptick in the elevated nature of the response that they get to it. So that is the reason they're asking these questions. And then the rest of this sheet is biographical information, where I live and all that. So I have another piece of paper here, and that is, they've given it to me. It's called the fact sheet for recipients and caregivers emergency use authorization for the Moderna COVID-19 vaccine to prevent coronavirus disease 2019 in individuals 18 years of age and older. And again, as I mentioned previously, a scanned copy of this form is going to be available at the end of this video. So I'm going to read this word by word, line by line, to explain everything it says here. I am being offered the Moderna COVID-19 vaccine to prevent coronavirus disease COVID-19, caused by SARS-CoV-2, which is the coronavirus that causes that disease. This fact sheet contains information to help you understand the risks and benefits of the Moderna COVID-19 vaccine, which you may receive because there is currently a pandemic. I am getting the Moderna. My mother is a physician, and she got the Pfizer one. So I don't know if she got all this. She is not really that cued into this. I am taking this much more of a novel approach. I'm much more excited than she is. She's just doing it because she has to for work. I am very excited, and I'm going to walk everybody through this to the best of my ability. Read this fact sheet for information about the Moderna COVID-19 vaccine. Talk to the vaccination provider if you have any questions. It is your choice to receive the vaccine, though I strongly recommend you get it if you have access to it, when you have access to it, because this virus is horrible and can kill randomly. The Moderna vaccine may not protect everyone. It does protect 95% of people, but I believe that number is slightly skewed due to a slight underrepresentation of people with pre-existing conditions, although the FDA regulatory body who looked at this vaccine did not mention that, though that is my suspicion. What you need to know before you get this vaccine. This is basically a description of what COVID-19 is. So it says COVID-19 is caused by a coronavirus called SARS-CoV-2. This type of coronavirus has not been seen before. You can get COVID-19 through contact with another person who has the virus. It is predominantly a respiratory illness that can affect other organs. People with COVID-19 have a wide range of symptoms reported, and then it goes on and repeats basically all the symptoms that you can get from COVID, like fevers, chills, sinus infections, shortness of breath, loss of sense of taste and smell, which is called anosmia in medical terms, and it just goes on, and death. What is the Moderna vaccine? Moderna vaccine is an unapproved vaccine. It is approved for emergency use, but it's not approved. That may prevent COVID-19. There is currently no FDA-approved vaccine. That is correct. They're hoping that this will be approved. Now let's go on to the next page. What should you mention to your vaccination provider before getting the vaccine? Now, this is a critical question here. This basically will give your primary care doctor, who is going to be the one that authorizes you to get the vaccine. For me, it's different because I'm getting it through my work because I'm a healthcare worker. But for the majority of people out there, they're going to be getting this through their PCP and in the United States through pharmacies like CVS and Walgreens. So basically, this piece of paper here is asking what you should mention to your doctor before you get the vaccination. This is from Moderna. This may be different for every vaccination company. I'm only speaking for Moderna. Tell your vaccination provider if you have any of these medical conditions, including allergies. That is self-explanatory because they want to know if you've had a previous history of anaphylactic shock so that they're aware that that is a remote possibility. If you have a fever, again, self-explanatory. They don't want you to go in there while infected, and they don't want to make your infection worse. If you have a bleeding disorder on a blood thinner, again, this is to cover their bases for bruising. If you're immunocompromised, this is a critical one right here. If you're immunocompromised, people who are immunocompromised are usually in the following states. They either have an autoimmune disorder, which is a disorder in which the immune system attacks itself. So, for instance, if you have a disorder like rheumatoid arthritis, or you have a disorder like if you have a disorder like rheumatoid arthritis or psoriasis or lupus or systemic lupus erythematosus, all of these are autoimmune disorders that make your immune system more vulnerable to severe consequences of viruses like COVID. The reason they want you to know this is because people who get the vaccine may be at a slightly higher risk of developing complications from it if you're immune compromised. If your immune system is not working, you may be more vulnerable. I personally do not see this as much of a threat as if you were getting a live virus or an attenuated dead virus. I really don't see the threat here because all you're doing here is getting injected with viral sequences that code for protein that the virus produces. However, I understand why they're putting it here. If you're pregnant and plan to become pregnant, this is because of the body of a pregnant woman is very different from the body of a non-pregnant woman or a non-pregnant man. And as a result, the effects of the vaccine on pregnancy may not be well known. If you are breastfeeding, again, it's not well known. They don't know if you will transmit the antibodies to your child, and they don't know what will happen if your child gets the antibodies through the breast milk. They don't want any complications to happen to the breastfeeding baby when the mother is getting vaccinated for COVID. If you ever received another COVID-19 vaccine, again, that was because they don't want any cross reactions. Who should get the Moderna COVID-19 vaccine? Everyone should get a COVID-19 vaccine. I believe that everybody should get a COVID-19 vaccine. The probabilities of reactions are very, 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 very small. And the media may sensationalize, oh, this doctor had to inject himself with an Epipen. But these reactions are slim to none. The probability of getting a reaction to this vaccine is the probability of getting struck by lightning within a calendar year. Think about it like that. Am I going to get struck by lightning in the year 2021? No, probably not. Then I am more likely than not going to get coronavirus from the vaccine or an adverse reaction to the vaccine. Just remember that this is slim to none. What are the ingredients? This is pretty technical. I don't really think I should talk about this because I think that it just mentions all the ingredients. And the reason that it does this is because it is for you to figure out if you are allergic to any of the components in the vaccine. The Moderna vaccine is given through an intramuscular injection into the arm. It is given in 2 doses, 1 month apart. Moderna vaccine has been used in clinical trials. It says 15,400 individuals have received the vaccine. That makes sense because the trial had about 30,000 people. And roughly 50-50 get the vaccine and the placebo, which is sugar water, essentially. And so in clinically relevant studies, they're called double-blinded, meaning neither the researchers nor the subjects know whether they get the vaccine or the placebo. What are the benefits of the Moderna COVID vaccine? It does prevent COVID-19. However, one thing I did mention at the beginning is that the duration of immunity is not known. And that will continue to be studied over the years. Now, what are the risks of getting the vaccine? They're very, very remote, but they are there. And I'm going to read them off to you so you guys are fully aware of everything that could happen. The most common ones are injection site reactions. So like, when you get a flu shot or any other shot, you have pain in the site of the arm where you got it. That is the most common one that I've heard. Just that and like swelling and just in general myalgia on the left or right arm. I'm getting on the left side, so I'm generalizing it to my left arm. But if you get in the right arm, it can happen there too. And occasional side effects, like in particular with the shingles vaccine, vaccines can cause fatigue, chills, shortness of breath. Not shortness of breath, fatigue, headache, muscle pain, chills. The usual stuff that you can get from vaccines and probably have gotten from one vaccine. There's a remote chance that can cause anaphylaxis. People who get the COVID vaccine are getting monitored for about 15 minutes, in my case 30 minutes, post inoculation so that they can be kept tabs of and be made aware if there is any potential for anaphylaxis. Signs of this anaphylactic reaction can include difficulty breathing, swelling of your face and throat, a fast heartbeat, a bad rash all over your body, and dizziness. What should I do about side effects? Call 911 or whatever the emergency services is in your country. We have been given an option to enroll in an app called vSafe, which is what I'm going to do. I believe that public awareness of the vaccine is critical in stopping this pandemic, and I believe that making people aware that the vaccine is not going to kill you is very good. What if I decide not to get the coronavirus vaccine by Moderna? It is your choice to take the vaccine. Then it just gives a series of questions. And then in America, what's happening is they're giving you a card, a vaccination card, where they're documenting the fact that you've gotten a vaccine. And I think they're going to be using this for sort of travel screenings post-pandemic. They're going to, make sure that everybody who, goes to a concert, goes to a basketball game, goes on an aircraft, has that card. So that they are not capable of developing and hopefully not capable of spreading coronavirus. And if you have any additional questions, it's saying to visit this website. There's a bunch of other websites here, a bunch of phone numbers that you can call as well. There's really nothing else on this form. So thank you guys so much for watching. I plan on making this a 2-part series. The second one is going to be when I get the coronavirus vaccine. I am going to post the picture of me getting it on Instagram. I am going to talk about everything. I'm going to be honest about how it felt to get the vaccine because I want to be upfront about this as much as possible. So yeah, thank you so much for tuning in and see you guys next time. Peace.